Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, home remedies to relieve diverticulitis pain fast. Home remedies like rest, using a heating pad, and taking pain relievers can help relieve diverticulitis pain fast. But by and large, home remedies for diverticulitis, such as avoiding red meat, exercising, and using fiber supplements, are part of a longer-term game plan for preventing flare-ups. /r/n/r/nrnvizbk, Getty Imagesrnrn Immediate relief of diverticulitis pain is challenging. Even strategies that help diverticulitis pain fast may not seem to act fast enough when you are having an attack. /r/n/r/n Nevertheless, these at-home strategies can help calm symptoms of a diverticulitis flare-up and lessen the time you spend in extreme pain. /r/n/r/n In about 95% of people with uncomplicated diverticulitis, it goes away on its own within a week. In about 5% of people with diverticulitis, the symptoms stay and medical treatment is needed. /r/n/r/n Certain changes to your diet and lifestyle won't provide instant relief, but they can calm down a diverticulitis attack with time and help prevent future attacks. /r/n/r/n The following home remedies for diverticulitis may be recommended by your healthcare provider. /r/n/r/n Switching to a clear liquid diet for a few days can help you start to feel better. A clear liquid diet includes drinks and foods such as /r/n/r/n Once your symptoms have improved, your healthcare provider can advise you on how to reintroduce solid foods into your diet. /r/n/r/n In years past, a low-fiber diet was recommended for diverticular disease. It's now known that not getting enough fiber through foods may be part of why diverticula develop in the first place. /r/n/r/n It's not known exactly how much fiber may help avoid symptoms. However, the American Society of Colon and Rectal Surgeons, ASCRS, recommends that, in general, adults eat between 20 and 30 grams of fiber per day, so this can be a helpful guideline. /r/n/r/n Foods that decrease inflammation associated with diverticulitis include /r/n/r/n Avoiding these foods may be recommended during a diverticulitis flare-up, as they may put added stress on the colon. In one study, people who ate less red meat had fewer bouts of diverticulitis. /r/n/r/n Eating red meat and processed meat may also increase your risk of diverticular disease in the first place. A 2017 study tracked the diets of 46,418 men for 28 years. The authors found an anti-inflammatory diet that included higher amounts of green leafy vegetables, dark yellow vegetables, coffee, and tea, with lower amounts of red meat. Processed meats, refined grains, and sugary beverages may help reduce the risk of diverticulitis. /r/n/r/n Drinking too much alcohol may increase the risk of diverticulitis by 2 to 3 times. Avoiding alcohol is usually recommended during a flare-up while following a liquid diet. /r/n/r/n It's usually recommended that people get enough physical activity for their age and their fitness level. For preventing diverticulitis, there have been mixed results in studies that looked into a link between exercise and diverticular disease. /r/n/r/n There are no specific recommendations, but it's generally thought that exercise may be helpful in preventing some cases of diverticular disease. /r/n/r/n There's limited evidence for or against the use of probiotics, beneficial gut bacteria, as a treatment for diverticular disease. /r/n/r/n One study showed that people with diverticulitis who took probiotics had less associated bloating, pain, and fevers. However, they didn't have fewer diverticulitis flare-ups overall. /r/n/r/n Talk to your healthcare provider for guidance before trying probiotics. /r/n/r/n fiber supplements may be recommended for diverticular disease when the condition is not causing symptoms. /r/n/r/n other supplements and spices that have been suggested for diverticular disease include /r/n/r/n. It's thought that some supplements may have anti-inflammatory effects. /r/n/r/n. Unfortunately, no clinical trials have been conducted on these supplements to determine if they have benefits. /r/n/r/n. The relationship between vitamin D and diverticular disease has also been studied. Research is limited, but one study showed that people with higher than average vitamin D levels were less likely to need hospitalization for a diverticulitis flare-up. /r/n/r/n. Using a heating pad, taking Tylenol, acetaminophen, and resting are all strategies you can employ at home to soothe diverticulitis pain faster, at least faster. /r/n/r/n. Most home remedies for diverticulitis aim to improve symptoms over the long term and prevent future attacks. Examples include getting more fiber, avoiding red meat, exercising, and trying supplements like garlic, ginger, and vitamin D. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.